السلام عليكم ورحمة الله وبركاته. إن شاء الله النهاردة هنتكلم عن attention deficit hyperactivity disorder prepared by علي رزق الخطيب under supervision of دكتورة معان المالكي professor of psychiatric and mental health nursing منوفية University assistant professor دكتور مواهب محمود زكي assistant professor of psychiatric and mental health nursing. Outlines: we will talk about definition, pathophysiology, statistics and incidence, causes of ADHD, clinical manifestations, complications of assessment and diagnostic findings, medical management, pharmacological therapy, nursing process, psychoeducation of caregiver. First definition: attention deficit hyperactivity disorder. It's a disorder or syndrome characterized by degrees of inattention, impulsive behavior and hyperactivity. From title: attention deficit hyperactivity disorder يبقى عندي problem في الاتنشن و problem في الاكتيفيتي. ADHD is a brain disorder marked by an ongoing pattern of inattention or hyperactivity impulsivity that interferes with functioning or development. يبقى that is a brain disorder. Inattention means a person wanders off task, lacks persistence, has difficulty sustaining focus, and is disorganized, and these problems are not due to deviance or lack of comprehension. Hyperactivity means a person seems to move about constantly, including in situations in which it is not appropriate or excessively fidget, taps or talks. Impulsivity means a person makes hasty actions that occur in the moment without first thinking about them, and that may have high potential for harm or a desire for immediate rewards or inability to delay gratification. Pathophysiology: both genetic and environmental factors contribute to ADHD. يبقى عندنا genetic و environmental factors، عوامل جينية وعوامل بيئية بتأثر على ال ADHD أو بتسببه. أول حاجة عندنا neurotransmitters زي الدوبامين والنورابinephrine are implicated in the pathophysiology of ADHD. الدوبامين هو النيوروترانسميتر المسؤول عن الريورد سيستم والريسك تيكينج والامبulsivity والمود، اما النورابinephrine ده مسؤول عن الاتنشن والمود. Statistics and incidence: بيقول لي ال ADHD valid diagnosis that affect من 3 ل 5% from 3 to 5% of school age children and may persist into adulthood. ADHD incidence rates are 5 to 10 times greater in the United States compared with other countries. Causes: the cause of the disorder is unclear. Developmental lag, biochemical disorder and food sensitivities are all serious under consideration. يبقى عندي الكوز الواضح ليها، مفيش كوز واضح لل ADHD، في كذا عامل بيأثر عليه بيؤدي ليها وأثر فيها زي ما قلنا الجيناتيك والنيوروترانسميتر، وعندنا برضو في developmental lag وبايوكيميكال disorder والفود sensitivities. clinical manifestation زي ما قلنا في الديفينيشن بقى عندي inattention، عندي hyperactivity وعندي impulsivity. الاناتنشن بيقول لي ان هو ما ممكن might not be noticed until a child goes to school. يعني ممكن الطفل قبل المدرسة ما لاحظش الاناتنشن ده، بنلاحظه في ان هو مش قادر يكمل الهوم وورك بتاعه، مش قادر يكمل الاكتيفيتي لحد الاخر. زي ما قلنا في مشكلة في sustain attention، هو يوصل الاتنشن بتاعه عنده فيه مشكلة، فده ممكن يلاحظ اكتر في حالة لما يخش المدرسة. الهايبر اكتيفيتي بيبقى عندي فيها فيدجت وسكويرم بيبقى التشايلد بيبقى متململ مش قادر يقعد، عنده تشنج، excessively talking، مش قادر يكمل يقعد فترة معينة على بعضها، لازم يقوم ويتحرك وموف. impulsivity قال ان هي symptoms of this include impatience, having a hard time waiting to talk or react, and frequently interrupt or intrude on others. بعد كده ال complication بيقول لي ان ال ADHD doesn't cause psychological او developmental problem، مش بيسبب حاجة direct، بس ممكن يكون له رول في condition زي التارت سندروم، زي الدبريشن، زي الoppositional deviant disorder، وزي البايبولار disorder, conduct disorder وanxiety disorder. Assessment and diagnostic findings. Diagnosis can be made after child is 3 years, but it often not made until a child reaches school. عشان اقدر احدد ان هو have trouble settling into routine of being in classroom setting، يعني ممكن نبدأ عند 3 سنين نشخص، بس مش بيتأكد غير بعد ما يدخل المدرسة. Medical examination may help rule out other possible causes of symptoms. ADHD criteria from the Diagnostic and Statistical Manual of Mental Disorder DSM-5 published by American Psychiatric Association has a list of the criteria that confirm the diagnosis of ADHD. الكريتيريا دي عبارة عن 18 question created by Dobol and colleagues. دي بتبقى عبارة عن أسئلة بتتسأل عبارة عن parent report أو teacher report عن آخر 6 شهور للتشايلد ده. بعد كده عندنا الميديكال مانجمنت. therapeutic approach to ADHD has been shifting. بستخدم عندي behavioral psychotherapy، ده بنستخدم عبارة عن psychotherapy effective when used in combination مع الميديكيشن، بنعمل فيه increase الorganization و decrease uncertain expectation. في psychosocial intervention وده في تو بروجرام behavioral parent training و behavioral classroom management are best used in conjunction with psychopharmacological approach. الكوجنيتيف ثيرابي فور adults with ADHD ده بيحصل لل ADHD adult patient. عندي فارماكولوجيكال ثيرابي بندي ستيمولانتس، بدي اتوموكستين وترايسايكليك انتي ديبريسنت ومودافين. نيرسينج مانجمنت. Nurses must be knowledgeable enough in taking care of patients with ADHD. Environmental and behavioral setting should be taken into consideration. Nursing assessment. Well, assessment of ADHD typically involves the comprehensive evaluation of information gathered from a number of sources زي ال family members، زي ال parents، زي ال teachers، زي ال partners وال colleagues. قلنا بيبقى فيه ريبورت من ال DSM-5 بيتاخد من ال teacher أو ال patient أو ال parent. في clinical examination و interviewing observations و rating scale. nursing diagnosis. عندي diagnosis related دي ADHD. في أول diagnosis defensive coping related to feeling of inadequacy and the need for acceptance from others. impaired social interaction related to developmental disability وال hyperactivity. altered thought process related to personality disorder. risk for parental role conflict related to children with attention deficit hyperactivity disorder. risk for injury related to psychological. risk for delay in growth and development related to mental illness. Nursing care plan and goals. The major goals for patients with ADHD are implement appropriate memory retraining technique. نعمل training للmemory such as keeping calendar, writing a list, memory cue games, mnemonic device using computers, and so forth. Encourage ventilation of feelings. لازم يعبر عن أحاسيسه of frustration, helplessness and so forth. Refocus attention to areas of control and progress. Provide for importance of pacing learning activities and having appropriate rest. Monitor client behavior and assist in using stress management techniques. Nursing intervention. The nurse's role in caring for the patient with ADHD involves the following. أول حاجة the nurse's role in caring for patient with ADHD involve accept the child or individual as what he is, consider his condition and communicate with him as an equal. تتعامل معاه زي ما هو. Approach the child at his current level of functioning. Don't use baby talk nor direct him as to his chronological age. Encourage him to express his thoughts or emotions and respond to him therapeutically. Use simple and direct instructions. Implement a scheduled routine every day. Avoid stimulating or distracting settings. Give positive reinforcements for the patient. Encourage physical activity. Evaluation. After implementation of care plan, the result of the evaluation should include implemented appropriate memory retraining techniques, encouraging ventilation, provide importance of pacing learning activity, monitor client behavior and assist in using stress management. Discharge and home care guidelines. اما بنبدأ نأهل البيشنت ان هو يحصل له discharge، نديله care for a child with ADHD at home include help a child build self-esteem, encourage a sense of belonging, help the child get the most out of school, promoting school success, help the child get things done, patience with persistence and creative things. Psycho-educational for caregiver. Psycho-education for caregiver. البيرنت او الفاميلي بنديهم psycho-education about establishing and maintaining a routine at home، زي التايم اوف بلاينج، الروتين بتاع الاساس في البيت، اوقات محددة للاكل والشرب تبقى ثابتة كل يوم. الكوميونيكيشن بنديهم education عن الكوميونيكيشن، ان هو لازم يبقى فيه اي كونتاكت ولازم يتعامل معاه with respect وبسيمبل sentence وما يطولش عليه عشان خاطر هو ما بيقدرش ان هو يكمل الاتنشن بتاعه. بريزنج ان هو يقدر اللي هو بيعمله ويبدأ يشجعه. شورت تاسكس، لو في تاسك كبيرة يقسمها له تاسك صغيرة ويديله تايم لكل تاسك صغيرة. giving breaks، اما يعمل اي activity لازم ياخد بريك بعده. و encouragement اللي هو التشجيع والتحفيز ليه. thank you.